Today we will be discussing about the India Hypertension Control Initiative. We all know that non-communicable diseases nowadays are the growing burden all over the world. In total, we can say that in the globally 74% of the all deaths are caused by non-communicable diseases, and most of these deaths are premature deaths, that is people are dying below the age of 70. And also the most of the deaths are occurring in the low and middle income countries, and India is one of them. And among the NCDs, mostly the 4 NCDs are the leading killers. Those are the cardiovascular diseases, diabetes, COPD, and so on. And among the cardiovascular diseases, hypertension is the leading single most important risk factor. So hypertension kills the most patient in the world right now, and in India. So India being a largely populous country, the disease burden is also very high. So in India Hypertension Control Initiative, what that has been started in 2017 is a combined effort with the Ministry of India and ICMR, WHO, and it is basically aims to achieve the greater BP control, and for that we have taken 5 crucial components. One of them is fixing a very simplified dose and drug specific evidence based standardized treatment protocol that is to be available with the primary health care for patient treating, and also it generally reduces clinical variability among prescriptions, and standard treatment protocol generally improved medicine supply chain or logistic management becomes easier when we have a standard treatment protocol. Also one of the other component is medicine supply, which is the backbone of this program. We have delivered or designed a tool that is able to forecast medicine, and we that way in the primary healthcare level we are generally streamlined the antihypertensive medications, and most of the patients are getting 30 to 60 days medication at the grassroots level, and there is no stockouts. And the other things are task sharing, that not every task to be done by a doctor. There are many paramedical workers or other health workers available who can do their job as well to improve the BP control, improve the NCD control. And other thing is patient centered care. You have to think of the patient, you have to treat the patient as a human being, and you have to see the issues, you have to give the prescription at the closer to the patient's home in order to improve the patient follow-up for NCDs. And last is our information system. Information system we have built up that is enable a healthcare provider to see his patients, how many of patients are under control, who are not coming, so that the patient can be called, the patient follow-up management can be improved. That's why we are right now we are having more than 6 million patients with us, hypertensive patients, and we are aiming in line with the government target, that is 75 million patients to be in a standard treatment protocol by 2025. So yeah, there are a lot of scopes and opportunity. We can move on to the private, we can engage all the private physicians, all the healthcare providers here, and big institutions, medical colleges and the industries, in order to get maximum NCD patients, in order to detect them early, save them young, and also we can put them on a standard treatment protocol, so the BP control of a country can improve, and thus we can prevent the heart attacks, strokes, and thus the premature deaths, disabilities, and thus a better world, a healthy world ahead.